Our next speaker is Dr. Hanaa Amer. Dr. Hanaa Amer is working as a head of Health Technology Assessment and Management Sector, Unified Procurement Authority in Egypt. Dr. Hanaa will present to us today the lecture entitled as a reimbursement of innovative treatments. Dr. Hanaa.
Assalamu alaikum jami'an. I am Dr. Hanaa Amer. I am professor in Ain Shams University, Faculty of Medicine, and now I'm the head of the Central Administration for Health Technology Assessment and Management in the Unified Authority for Procurement in Egypt. I'd like to share, first of all, I'd like to thank the organizing committee for this kind invitation to join you in such an eminent seminar. It's really an excellent meeting, having so much important information. I'd like to share with you our experience in the Egyptian Authority for Unified Procurement and how we are working now as the first GHAA national unit in Egypt, and what we are trying to do in order to help in the reimbursement of the new medicines. This is our motto in the Egyptian Authority for the Unified Procurement, Medical Supply, and the Management of Medical Technology. In a brief description, the healthcare sector is one of the main areas of the focus of Egypt 2030 vision, and it was established as an integral part of the current healthcare reform. In other words, the Unified Procurement Authority role is to contribute effectively to the achievement of the core values of Egypt 2030 healthcare vision, which its main pillars are equity, solidarity, and the efficient allocation of resources. Our vision is paving the way to the attainment of universal health coverage in Egypt. We are trying this through our mission with a centralized procurement and supply interface. The UPA aims to ensure equitable access of medical and health technology products through conducting evidence-based technology assessments, value-driven procurement methods, and establishing a robust and a sustainable supply chain. From the mission, you can find our organizational framework. We have three main centralized administrative units. The first of which is the centralized management of medical technology, through which we have many departments working through planning, feedback, and training, and societal awareness. We have the centralized management of procurement. Through this, the centralized management unit for procurement, we are mainly adopting the policies for tendering, which is an approach that aims to achieve lower prices by awarding the contract to the best offer regarding the quality, not comprising the quality. For high-priced medicines that are mainly used in the hospital sector, individual hospitals and hospitals groups often apply these tenders, but now through the UPA, we have this centralized strategic purchasing procurement policy in order to have a strategic positioning with our suppliers so we can achieve a cross-country collaboration and get the best prices for the best offers. The last administration unit is the medical supply, through which we are trying to manage the inventory and the supply chain, and so that all the products can reach the end user at the right time and at the right quantity. Now we are working on the efficient allocation of resources, creation of a healthcare service with equitable access through achieving the 5 R's, which are the right HTA for the right patient, right time, right cost, and right quality. Our objectives are mainly achieving financial sustainability for the Egyptian healthcare system, attaining the objectives highlighted in the Egypt's 2030 healthcare vision, maximizing the country's resources and increasing the efficiency of the inventory management process. Also, we are trying, hopefully, for opening new markets for exportation of the Egyptian products, ensuring the sustainability of the service through the continuous availability of medical products, supporting the inclusive health insurance project evolving in Egypt, the social insurance, health insurance, and increasing the competitiveness of the local pharmaceutical industry. This can be also done by fostering inter-regional collaborations, improving the country's trade balance, and improving the business investment climate. And lastly, by enhancing the productivity of the medical supply chain operations. Our work plan mainly, now I'm talking about the HTA. Our work plan first comes with the classification and demarcation of all the regions and governorates and directorates in Egypt. Training of all those working in this field for their training needs assessment, training proposals and materials, and starting from all the healthcare workers, nurses, pharmacists, doctors, all of them are our target audience for these training and awareness campaigns, so that we are trying to build a real needs assessment with a demand list which is very realistic. We are trying to decrease the waste. We are trying to decrease all types of waste of transportation, of the inventory, of the even overproduction, over demand. All of this waste we are trying through the training needs assessment to be put in mind in order to build a good demand list from the stakeholders' side. Then we are trying to make budget verifications and then capacity assessment. As for our long-term plans, after this needs assessment, we are going to prioritization and aggregate demand analysis of all the needs, then budget planning, of course, data collection and health economic evaluation, procurement processes, and partnerships. Then we are revising the inherited ongoing and ratified deals and contracts. For the HTA, it's well known that HTA as a policy is now introduced, has been gaining importance across all countries, and the HTA agents have been formally cooperating at all levels, and new proposed regulations are now aiming to further intensifying the institutionalizing this collaboration. HTA is mainly a technical evaluation tool that informs decisions, reimbursement, and pricing by evaluating the clinical, economic, and other consequences of new medicines. It cannot, however, it cannot be in isolation make these decisions. Diverting from HTA findings, payers are sometimes willing to accept high prices for relatively low benefits. So we are working all together with other national agencies like the Egyptian Drug Administration, now the Pharmacoeconomics Unit, Dr. Gianni Sisi has been talking about. We are working in a collaboration to trying to put a value-based pricing and considering elements of all the elements she mentioned for the value-based pricing that have been gaining importance all over other more developed countries, as in Europe, for example. Classically, this is one of the strategies. It is taken from a policy brief done by the WHO in 2017 in Austria. They describe two simplified rules for HTA, either by considering the price or without considering the price. Considering the price, as in Sweden, for example, they depend on the necessity, effectiveness, and patient-relevant benefits, and then cost effectiveness when the price is involved. So we can calculate if they are going to be reimbursed or restricted or conditionally coverage with evidence developments, or not to be reimbursed. Of course, in Egypt, cost effectiveness is one of the main tools we are working with in order to decide or to help the decision makers for the reimbursement. If HTA is going to work without the price, this will be mainly through the clinical outcomes or the clinical benefits. So the price setting or negotiation is depending on the added benefit from the clinical point of view mainly, without putting in consideration the cost. For HTA, the responsibilities and the structure, which we, we are trying to build up in the UPA, in the UPA. First, considering the responsibilities and the structure, we are putting the job descriptions, the function. We are building our expert committees. We are mainly topic selection according to the priorities of the what is needed in Egypt, and we are building the guidelines. In this, we are collaborating with so many different parties, like the different CROs. We are helping with other governmental agencies, as I said, like the Egyptian Drug Administration, the Supreme Council for Higher Education, with the Ministry of Health. We are trying to build the guidelines, sharing them with all our stakeholders. Then comes the evidence and evaluation criteria. As regard the studies for the burden of the disease, therapeutic innovations, socioeconomic matters, efficiency, and others. For methods and techniques, of course, we are, as I said, we are having the analytical methods, the cost effectiveness for the economic evaluation, clinical evidence. We are making a systematic review of literature, resources and cost, discounting. Of course, the horizon scanning also is a supportive tool that can help to prepare for the pricing and the reimbursement of medicines, and that have establishing and maintaining an effective system. Lastly, we have our outcome implementation, which helps in the public availability, policy implication, and access restrictions, and the dissemination. As I've said, we have been working in the HTA unit in the UPA in Egypt since the start of July 2020. We are now, as I said, we are building the guidelines. We are making studies for the cost effectiveness needed for the reimbursement of the cost of the high-priced drugs in collaboration with other agencies. This is also one of the strategies proposed by the WHO, as I said, in the policy brief launched in Austria in 2017. And it's mainly while we are revising all the guidelines to adopt our own guidelines, we found that we can put in consideration. First of all, is a strategic procurement, as I said, because mainly the Unified Procurement Authority is now the only body that can go on procurement of all healthcare needs for the governmental sector of the healthcare services. So strategic procurement, of course, considers different options depending on the life cycle of the medicine and its position in the market. There's evidence about the effects of strategic and less strategic procurement on cost containment and the access of medicines. And this is really now done through different tenders have been held by the UPA. and the cost containment was evident to all those who are working with us. Of course, we are still in need for the capacity building, and it is always will be required. For the regular price and reimbursement revisions, these are also done because for different by different entities. For example, we have many initiatives now in Egypt as regard the women's health, the child's health, and during these initiatives, we are also doing some revises for the prices and reimbursement agreements. As Dr. Bandar and Dr. Hanaa were just explaining, there are different managed entry agreements were done during these initiatives due to the high volume and the market share that are going to be used during such programs. Of course, the good evidence on the savings of the potential of the price revision and regular revisions likely built into performance-based managed entry agreements, and the experience showed challenges for the authorities and payers due to the high level of administrative resources required and the cost, of course, of these drugs. The consideration of and the discounts and the ability to pay and further improvements in the responsibility of the producers. Of course, these are also needing more revision and more strategically studied agreements and policies. There is evidence, of course, of cost-containing effects, which is evident in the European countries, and we are trying, of course, when we adopt such strategies, to revise it in other, in Egypt and the other Middle East countries. Also, the improved coordination in the HTA, as I said, HTA is a useful tool for determining the value of new medicines, and possible advantages have been well documented both at the national and over other countries. And that's what our nowadays ongoing work to build the HTA unit in the Unified Procurement Authority, and to help in making such studies for different disciplines in the healthcare service, in favoring of the reimbursement and lowering the prices and increasing the accessibility of such services to all of our citizens. Lastly, increased use of biosimilar medicines, and this is also a trend going on to make biosimilar medicines as an effective instrument to support financial sustainability. Thank you very much.